Hello, everyone. Good afternoon to all of you. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They look like freckle, like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across four Indian cities, reveals that more than 80% of the population presents skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this very common hyperpigmentation issue. This can lead to frustrating setback in treatment. And to avoid all these hazards and to keep you informed, today we are here to know about the management of melasma from an expert. So let's connect today with our skin expert, Dr. Krupa Ajmera Modi from Mumbai. She is consultant dermatologist. Dr. Krupa Ajmera Modi has done her MBBS from KJ Somaiya Medical College, Mumbai, and MD DBL from Dr. D.Y. Patil Hospital, Navi, Mumbai. Her areas of interest lies in urticaria, vitiligo, hair loss, dermatosurgery, and laser. She is an expert in providing treatments like skin rejuvenation, melasma, anti-aging, and various facial concerns treatment. She has a very vast experience in different types of laser and hair treatments. She has many publications on her name and has participated in different international, national, and state medical conferences. With her expertise, today, Doctor will enlighten us more about the melasma and, of course, how to manage it. A very warm welcome to you, Dr. Krupaj Meera Modi.
Thank you so much, Sayukta. Thank you for such a kind introduction. And we're
It's
here
such
to
a
talk about melasma. Yeah. So,
Yeah, doctor. And it's such a pleasure to have you with us for such an important thing because, as I have already mentioned initially, that melasma is a very common chronic disorder in India. So, we see a lot of people, especially women, with melasma. So, it's important to know about it from an expert like you. So, doctor, what is melasma?
so melasma is a very common chronic condition in which we see brownish gray spot on the face. So usually seen on the cheeks, it can be seen on the forehead, on the nose, on the chin, on the upper lip. Okay, it's commonly seen in female more than male, and it has a hormonal component to it. So it has genetic predisposition to it and a hormonal component. Hence, the way you said, the Indians are more prone to melasma because of the ethnicity. That is, darker skin tones are more prone to melasma.
So, as you have very well explained, what is melasma, and as we were talking that how common it is in India, we would like to understand what causes melasma.
So the causative agents for melasma would be first, as I mentioned, genetic predisposition. So commonly seen in families. So if a person comes with melasma, we most commonly ask them their mother or their sister or their maternal aunt, Masi, and somebody would also have melasma. So these are one of the common indications where it shows genetic predisposition is one of the most important things. Then the second thing we talk about is ethnicity. That is, darker skin tones will be more prone to melasma. Third is melasma has a very major hormonal component. Hence, it's usually seen during pregnancy. The melasma which occurs during pregnancy is also called as cloasma, that is mask of pregnancy. So it's commonly seen when there are hormonal imbalances happening in the body. So it can be seen during pregnancy. It can also be seen more commonly during menopause or perimenopausal age. So when a woman on in their menopausal age is approaching, they usually tend to start developing this pigmentation on their skin. And it's very frustrating for them because obviously at that age, when you see the dark brown patches on your cheeks, it's not very visibly pleasant. Hence, they're very frustrated and they don't know what to do about it.
Right.
Now, another indication which is in our hand is sun exposure. So, sun exposure also leads to melasma. So, prolonged sun exposure can lead to melasma, as well as few cosmetic products can also cause melasma. So, these are the common conditions in which melasma is seen.
Okay. Now, doctor, as you said that, due to hormonal changes, hormonal imbalance, melasma can, occur. And that's why we see a lot of patients of melasma in women who are menopausing, as you just mentioned. There is another term which is very much like melasma, but very common with people with mass. melasma एक ऐसा टर्म है जो थोड़ा टेक्निकल हो जाता है, कई लोगों को नहीं पता, लेकिन हाइपर
Right.
पिगमेंटेशन कई लोग इसे जानते हैं। कई बार यही हम कहते हैं कि सी मुझे पिगमेंटरी डिसऑर्डर हो रहा है या पिगमेंटेशन हो रहा है। सो आर दीज टू डिफरेंट, हाइपर पिगमेंटेशन एंड melasma, or are they the same?
Now, melasma, as we talked about, it's a very specific terminology used for pigmentation that is happening around the cheeks or on the forehead, more commonly in the female age group, and because of hormonal causes. Whereas hyperpigmentation is a very broad terminology which means nothing but darkening of the skin. Now, there can be n number of causes for this. As we said, melasma is specific to hormonal, pregnancy, UV exposure, and all. Hyperpigmentation can be because of anything. It can be because of sun exposure, it can be because of any inflammatory diseases, it can be because of a post inflammatory hyperpigmentation that we see. It can be because of acne. Like acne usually heals with hyperpigmentation. We must have seen everyone goes through all of those things.
Right.
Any injury, any scar. So that is like causative agent for melasma and hyperpigmentation are different. Now, second thing is appearance. Appearance wise, melasma looks like a brownish spot on the cheeks, whereas
Mhm.
hyperpigmentations are usually small wherever you get that injury or wherever you had the skin disease, like any inflammation or any acne. So these
Mhm.
are irregularly spaced spots which can happen anywhere on the body and on the face as well. They don't have usually a symmetrical pattern, whereas melasma is usually seen symmetrical on both cheeks and all because of the exposure.
Right.
Then what we call is the trigger. Triggers are again melasma is hormonal and all. Whereas hyperpigmentation can be because of anything and it gets increased because of sun exposure.
Mm.
And treatment for them also has few common things but few different things also because of the causative agents and the depth of the pigmentation. So melasma is something which is seen epidermal, dermal also. Hyperpigmentation can also be dermal. So it depends on the type of the patient, the type of the lesion, the treatment modalities change.
Mhm.
That is the basic difference between melasma and hyperpigmentation.
Right. So the bottom line is that melasma is quite specific and mostly because due to hormonal disbalance, etc. And hyperpigmentation is a broader term, right?
Right.
Now, doctor, as we are talking of melasma, we know that again in our society we have this, tendency of associating pigmentary disorders or melasma as a concern of age. I mean, as I'm aging, I'm bound to have these things, and we are okay with it. We have in a way accepted it as well. कई बार जब लोगों से पूछा जाता है कि आपको melasma हो रहा है या pigmentary कुछ disorder है skin पे, तो आपने डॉक्टर को क्यों नहीं दिखाया? We end up trying, home remedies, etc. But we refrain from going and taking advice from an expert like you, from a dermatologist. That's because हमें लगता है कि अभी तो एज हो रही है तो ये तो होगा ही, तो फिर इसमें डॉक्टर को दिखा के क्या होगा, ये तो होना ही है. What's your take on this? I mean, is it okay to associate it with age, or we do have a treatment?
So now first thing to talk about that is I feel like everybody has different skin conditions and everybody has different skin issues or concern.
Right.
If somebody is okay to live with it and are happy about it, I would always say be good to in your own skin. There is no
Hmm.
problem with that. If you have
Absolutely.
accepted and you're happy with it, there is nothing to do with it. But if you're not happy and you're struggling with it, then definitely meet an expert so that the expert can guide you for the right treatments and we have very good treatment modalities available for melasma. Like earlier, now the problem is why home remedies will not work too much for melasma is because the pigment is deep inside, it's dermal pigmentation. So our
Right.
creams, normal creams, also take a very long time in working for melasma. Hence we have to add few procedures and stuff for melasma. So a combination approach is the only key in which melasma can be treated. It cannot be treated only by a home therapy or just home creams. It has to be a combination of home care as well as in clinic procedure which helps melasma because it's a very stubborn pigmentation which happens in the on the face.
Mhm.
So I would always say, if you're happy and you're okay with your skin and it doesn't bother you at all, there is no problem with it. If you're not happy, then definitely meet a doctor and find a solution for it. If you're a little bit in between, you don't mind it and you feel like, oh, you didn't know there was a treatment option available, then I feel like you should be enlightened with the knowledge that there are many different treatment options available to treat this now.
Right. And that's the whole purpose of having this session so that we can spread some amount of awareness in people in society. Now, as you said, अगर लोग इससे खुश है, अगर उनको कोई परेशानी नहीं है तो ठीक है, you can definitely live with it. But if you have a problem, then you need to choose the right path, which is going to the right person, going to the correct person, which means a qualified dermatologist. Now, the problem is that we have easy access to over-the-counter products to any chemist shop. हमारे पास हमारे friends है, relatives है, influencers are there these days
Right.
online, and they have remedy for almost everything. और home remedies पर तो हमने बात की ही. Now, as I was talking before as well, कि हम डॉक्टर के पास जाने से पहले हम सब कुछ कर लेते हैं. Only when we feel that the condition has become worse or it has gone out of control, that's when we go and land up in front of a doctor.
And
Now,
sometimes we make it worse and come to the doctor. कि हमने
right.
ये सब कर लिया है and half the time we ruin our skin and we come to the doctor. So that is something we should avoid.
Exactly. And another reason of having this session is to spread the awareness that why it is important to go and consult a doctor at the very first place. क्योंकि कई बार ये होता है कि हम बहुत सारे ट्रायल्स एंड एरर्स करने के बाद जब जाते हैं तो हमारा ट्रीटमेंट और ज्यादा लेंदी हो जाएगा बनस्पत की अगर हम पहले ही चले जाएंगे. तो क्यों डॉक्टर ये जरूरी है, और इसके फोकस में मैं रखना चाहूंगी ओवर द काउंटर प्रोडक्ट्स को, क्योंकि बहुत सारे प्रोडक्ट्स मार्केट में अवेलेबल है जो क्लेम करते हैं कि आप अगर इन क्रीम्स को, टॉपिकल क्रीम्स को अप्लाई करेंगे तो आपका melasma, पिगमेंटेशन ये चला जाएगा. And what happens, because initially when we try these creams, they work wonderfully. तो हमें लगता है कि अरे हमारे हाथ तो कोई मैजिक क्रीम लग गई है. We keep on applying it, and we fall in love with that cream unless and until we become a एडिक्ट ऑफ इट. और उसके बाद हम देखते हैं कि जब हम नहीं अप्लाई करते हैं तो बहुत ज्यादा प्रॉब्लम हमारी स्किन पे होने लगता है. सो व्हाई दीज ओवर द काउंटर प्रोडक्ट्स आर सो एडिक्टिव इनिशियली, और फिर बाद में ऐसा क्यों हो जाता है?
So I'll tell you one of the most important key factors. The way you said that हम normally क्या करते हैं, chemist के पास जाते हैं, हम बोलते हैं हमको ये है, he gives you an over-counter medication. For a while you are happy with it, so you get so happy that you feel like you are a doctor yourself. इसलिए हमको लगता है मुझे ठीक हुआ तो मैं मेरे पूरे फैमिली को, मेरे फ्रेंड्स को, मेरे सराउंडिंग को, सोसाइटी सब में ये अवेयरनेस क्रिएट करूं कि किसी को जरूरत नहीं है डॉक्टर के पास जाने की, मेरे पास ये जादुई दवाई है, आप भी ये यूज करो, मुझे भी हुआ. नाउ द मोस्ट इंपॉर्टेंट फैक्टर एज वी सेड इज, देखो हर पिगमेंट आपके लिए एक सिर्फ दाग है. But after thorough studying of so many years by so many doctors with so much of research, we come to know that every pigment is different. It is present in different levels of the skin. And every cream is used for different modalities and different timings.
Right.
The way sometimes जो cream हम भी देते हैं, okay, like melasma के लिए, आज हम melasma की बात करें तो I'll just focus about melasma. कि melasma में there is something called triple combination that we give. Now, very important key factor, there are multiple creams available for melasma also. Right. Now, melasma के लिए जो हम ट्रिपल कॉम्बिनेशन भी देते हैं, हम पहले ही एडवाइस करते हैं कि it should not be used for a longer time because it has substances like hydroquinone or a topical corticosteroid which is not very good for your skin for long term. Hence we use it also for a short term medication. अभी कभी कभी हमारे साथ भी क्या होता है, हमने वो दवाई दी पेशेंट, पेशेंट को इतना अच्छा लगने लगता है, उनको लगता है वापस डॉक्टर के पास क्यों जाना ही है। हम लिखते हैं फॉलो अप आफ्टर 30 डेज, उनको लगता है 30 डेज कभी खत्म ही नहीं होते, वो आ जाते हैं हमारे पास 1 साल 2 साल बाद, जब वो क्रॉनिक यूज की वजह से स्किन में हार्मफुल साइड इफेक्ट्स भी हो जाते हैं। इसलिए हर टाइम पर हर चीज में देर इज अ मेथड ऑफ यूजिंग इट एंड देर इज अ ड्यूरेशन इन फॉर विच वी कैन यूज सम क्रीम। बट अभी मिलाजमा के लिए काफी सारे नए नए क्रीम्स वगैरह आए हैं। नाउ दिस हैज साइड इफेक्ट्स आल्सो, विद इफेक्ट्स इट ऑलवेज हैज अ साइड इफेक्ट। हेंस इट इज वेरी इंपॉर्टेंट टू नो कि आपके लिए वो सूटेबल है कि नहीं। इसलिए आई वुड ऑलवेज सजेस्ट कि rather than doing it over the counter or taking just from a friend, visit a dermatologist, visit a qualified person, क्योंकि influencers and all also have a very short knowledge about that thing। जो इंटरनेट का दिया हुआ नॉलेज होता है वो वापस स्प्रेड करने की कोशिश करते हैं। नॉलेज इज एब्सोल्युटली ब्यूटीफुल, बट हाफ नॉलेज कैन बी वेरी डेंजरस, and that is very important. That is why that you meet a qualified person, decide a plan of action for yourself, and then choose what you want to do rather than making a decision haphazardly।
राइट। हमें जब भी कोई तकलीफ किसी और ऑर्गन को लेकर होती है, हार्ट में अगर चेस्ट पेन अगर होता है, तो हम कभी सेल्फ मेडिकेट नहीं करते, हम होम रेमेडीज नहीं करते। हम सबसे पहले डॉक्टर के पास जाते हैं, बिकॉज वी नो कि कुछ भी हो सकता है, बहुत डेंजरस है सेल्फ मेडिकेशन या फिर होम रेमेडी इस वक्त ट्राई करना। अगर कुछ प्रॉब्लम है तो हमको सबसे पहले एक डॉक्टर के पास जाना चाहिए। लेकिन स्किन को लेकर हम थोड़े लथार्जिक हो जाते हैं, शायद हमको लगता है स्किन चूंकि आउटर लेयर है, तो हमको लगता है इस पे हम बहुत कुछ ट्रायल एरर कर सकते हैं। लेकिन प्रॉब्लम ये
फॉर्चुनेटली
है कि
स्किन बहुत फॉरगिविंग भी रहती है, इसलिए
हाँ
वो फॉरगिव करती है, बट यू डोंट वांट टू लैंड अप इन दोस 1% people where it is causing a very harmful effect on your skin। And as you said, skin forms the 90% of your body,
राइट।
and that is something that gives you appearance, that is something that gives you confidence, that is something which represents you in a lot of way। So हम उसका भी ध्यान रखना बहुत ज्यादा जरूरी है।
राइट। और हो सकता है जब मलाजमा है और मान लीजिए आप डॉक्टर के पास गए और डायग्नोसिस हुआ और पता चला कि हार्मोनल इम्बैलेंस है या फिर कोई और अंडरलाइन कंडीशन है, तब आपको समझ में आया कि अच्छा ये तो कुछ और ही प्रॉब्लम है, तो पहले मैं वो प्रॉब्लम ठीक करूं। तो इसलिए भी बहुत जरूरी है, और इसीलिए ये भी जरूरी है कि हमारे किसी फ्रेंड को या फैमिली को अगर ये हुआ है, तो हम उनका प्रिस्क्रिप्शन फॉलो करना ना शुरू कर दे, जो अगेन एक बहुत ही कॉमन टेंडेंसी है। हम डॉक्टर के पास जाए, बिकॉज एज डॉक्टर हैज वेरी वेल सेड, एवरी स्किन इज डिफरेंट, एवरी स्किन कंडीशन इज डिफरेंट, एंड इट्स इम्पोर्टेंट टू
जैसे आपने
अंडरस्टैंड
बोला
व्हाई
ना
यू आर हैविंग दिस
सेवंती,
प्रॉब्लम।
या
यस।
अब सेवंता, yesterday evening only I treated a patient who came to me saying कि मुझे वार्ड से मुझे वार्ड निकालने हैं, viral warts, which is a viral infection। But at the same time, when I saw it, I had to tell her that no, this is not viral warts. These are normal skin tags। So what she was worried about कि मुझे वायरल इन्फेक्शन हो रहा है जो इतना ज्यादा स्प्रेड हो रहा है, वो कॉज था ही नहीं। उसको एक्चुअली एक मेटाबॉलिक सिंड्रोम हो रहा था बिकॉज ऑफ ओबेसिटी, बिकॉज ऑफ मेटाबॉलिक प्रॉब्लम्स हैपनिंग अराउंड डायबिटीज एंड ऑल, उसकी वजह से वो उसको हो रहा था। पर उसको लग रहा था वो वर्ड से, बिकॉज सबके लिए छोटे छोटे पैप्यूल्स इट कैन बी वेरी मिसलीडिंग। Hence, it is very important to visit somebody who knows what you are talking about. And skin is a mirror of what is happening inside your body।
राइट।
इसलिए जब भी डायबिटीज वगैरह आपको होने वाला है, स्किन इज द फर्स्ट पर्सन हु विल गिव यू अ हिंट, विल गिव यू अ गाइडेंस, विल गिव यू अ अलार्मिंग साइन कि सुनिए मुझे अभी आप ध्यान रखना शुरू कर दीजिए। When we see hyperpigmentation around the neck, acanthosis, this and that, we always warn our patients very quickly कि आप ये टेंडेंसी में जा रहे हो एंड अभी भी आपके पास वक्त है, आप कंट्रोल करके अपना लाइफस्टाइल चेंज करके यू कैन बी बेनिफिटेड एंड आप बड़ी बीमारी से बच सकते हैं।
राइट। ट्रू। And doctor, as we know, we very commonly use this phrase specifically in medical field that prevention is always better than cure. Any way to prevent melasma?
So, few key factors to prevent melasma is taking care of what you are eating. So, as we said, hormonal imbalance causes it. So, if you have a genetic tendency, if you have family history of melasma, make sure to tell your gynecologist who's putting you on oral contraceptive pills or anything that you have a tendency. So, please be careful with those medications. One of the most important thing is sun exposure. इसलिए using a good SPF sunscreen इज वेरी की इम्पोर्टेंट फैक्टर. हम काफ़ी टाइम मिसलीडिंग है कि बाहर नहीं जा रहे हैं, समर नहीं है, बाहर
Hmm.
धूप नहीं दिख रही है, तो हमें सनस्क्रीन की ज़रूरत नहीं है. So please let me enlighten you again for that. That is a myth. We've been all focusing on that since a very, very long time. कि sunscreen is important all throughout the year. Whenever, if you're indoor or outdoor, it is still important because sun rays can reach you inside the house as well. And at the same time, one of the key important things that we are forgetting these days is we have lights in our houses when you are staying inside that
Hmm.
also emits a lot of rays.
Oh.
So I will tell you one of very interesting fact which a lot of people miss is that whenever you're working too much with the gas also it releases gamma rays,
Oh.
and people who are working too close in the stove near the oven and also lead to melasma quite a lot because of exposure to the gas and the oven. So
Mm-hmm.
उनको लगता है बिकॉज मेलाज्मा काफी टाइम हम हाउस वाइफ्स में देखते हैं उनको लगता है हम सन एक्सपोजर तो करते ही नहीं है.
Right.
But then with a careful history we come to know that they're working too much in the kitchen, and because of that they're getting. Now the solution cannot be कि हम कुक करना बंद कर दें
Hmm.
because हम घर पे खाएंगे क्या.
Ah.
But one important thing that we can do is कि cooking time reduce करिए.
Ah.
Because housewives की आदत है कि सब कुछ साथ में करते हैं because of time constraint. But try and do your non-gas work like chopping and all of that beforehand. And जो cooking का काम है जब गैस के पास रहने का काम है वो टाइम रिड्यूस करने की कोशिश कीजिए ताकि ये पिगमेंटेशन कम.
Okay. You have versus so many myths क्योंकि कई बार लोगों को ये लगता है और ज्यादातर लोगों को ये लगता है कि हमारा तो सन एक्सपोजर है नहीं. I'm working from home. I'm working mostly in front of a laptop. But as you said, devices also are emitting harmful radiations. Or I'm working inside the kitchen most of the time. I'm equally prone to harmful radiation. My skin is getting damaged due
So
to
it
those
is
harmful.
even that specific Samukha that sometimes right now where I'm sitting in my house, I'm sitting just right next to a window. So some
Hmm.
people have a habit because they want a fresh air and fresh lighting. That's why they
Right.
sit next to the window. तो उनका एक साइड का पिगमेंटेशन हमेशा ज्यादा डार्क रहता है because of the way they sit and where the sun comes. So these are little things where if we have knowledge, we will be able to prevent these types of pigmentation very often.
So we need to use sunscreen on a regular basis, regularly, religiously. We need to apply sunscreen,
So
right? But then
sunscreen is one
again, there are
chemical way of working. I'm sorry, Samantha, I'm cutting you.
yeah, no, no,
Sunscreen
it's
is a chemical way of protecting, but physical
uh-huh.
measures also like cap or a scarf when you're going out and all also helps. So wide beam cap should be used. These are physical measures by which you are limiting the sun exposure.
Right. But the irony is that in India, 67% of people are yet not using sunscreen as a regular skincare thing. And they have various complaints or excuses to put forward, like sunscreen makes my skin look very dull, or it makes my skin very patchy, or very, I sweat a lot after using sunscreen. I don't like the white cast, etc., etc. So, what's your advice to all those who are yet not using sunscreen as a regular thing and have various complaints with?
So I would say that Samantha, first thing we have amazing. So this was a problem earlier in life where sunscreens were not of very good quality. They were doing their job, but the consistency and the nature of the sunscreen was not very user friendly. But nowadays we get very good gel based sunscreen, matte finish sunscreens, sunscreen without a white cast, sunscreen with a tint. So these are amazing sunscreens which you will love to use. If you go on my Instagram handle, I have a post on sunscreens, which are my favorite ones. So
Mhm.
you guys can go and check it out. and use a sunscreen which you love, because something that you're not going to like, you cannot use it forever. So if you're
Right.
not happy with your sunscreen or something, go meet a doormat, tell them what is your concern, and find a best sunscreen for you. So always before deciding your skincare routine, rather than just meeting an influencer and finding out what is there, meet a doormat who can help you with your specific concern, what you require, and choose a
Right.
skincare routine for yourself. So one visit to a doormat can help you for a long time. If you're using good skincare products and you're doing
Mhm.
it religiously, why not use products that are going to help you even more, right?
Absolutely. And when we go out for purchasing a sunscreen, there's so much of information on the box which contains the sunscreen, right from SPF to boot star rating to broad spectrum or non broad spectrum. There are so many informations. What are the basics to go for, doctor?
Sunscreen, go for a broad spectrum sunscreen because you want to take care of UVA, UVB, and gamma rays as well.
Mhm.
So go for a broad spectrum sunscreen, and anything between SPF 30 to 50 should be okay,
Okay.
because SPF 30 means 93% protection, whereas SPF 50 means 95% protection. So the difference is very small. So anything between 30 to 50 should be good for you. Less than 30 is not a very good option. And as well as, try to choose a sunscreen, the finish that you like. Like some people like a moisturizing based sunscreen, some people like a matte
Mhm.
finish. Some people who have acne prone skin will like a non-comedogenic gel based sunscreen. So these are the few ingredients and few consistency that you should check for in a sunscreen.
Okay, doctor. Again, one way where we are confused is how much sunscreen, the quantity we need to apply. A reapplication we know is equally important. How and when to reapply? Please shed some light on that as well.
So the ideal quantity on how much sunscreen should be applied for a face is two hand, two fingers. So
Mhm.
this much sunscreen should be applied on a face. So sunscreen is something where your quantity is very important. So two finger is the unit that we have.
Hmm.
That much sunscreen should be applied on the face. At the same time, reapplication is one of the key important things, and sunscreen should be reapplied every 2 to 3 hours. Hence, I always advise my patients to apply the sunscreen at 8 a.m., 11 a.m., and 2 p.m. because these are the key important fat time when the sun is maximum and the UV radiation can damage your skin maximum. So try and apply your sunscreen 3 times a day at least. And for reapplication, you may use a powder sunscreen as well, because if you're a working person, makeup on and all, and you don't want to do gel base and some sunscreen again, or don't want to redo your makeup, you can use a powder based sunscreen for reapplication.
Okay. So the bottom line stays that you need to apply sunscreen regularly and religiously. Now, coming back to our main topic, melasma, doctor. When a patient comes to you, how do you diagnose? Are there various ways or tests, etc., or just by clinical examination you can tell that yes, this is melasma, and this could be the reason for it?
So melasma clinical examination gives you a very good key important factor, and there is hardly any need to do any other factors, test or anything. But if you're in doubt because of any other reason, after clinical examination, you can do a Wood's lamp, which gives you an idea on where the pigment lies, whether it's epidermal, dermal, depending on the light reflected. Or you can do a dermoscopy, which is a handheld portable dermoscope, which gives you magnification and gives you an idea on how to focus this. At the same time, medical history also plays an important role. And if you're still not convinced, then you can do a biopsy from the lesion and find out for definitive diagnosis if it is melasma or not.
Okay, and what all treatment options are there, doctor?
Now we are coming to the main thing. So
Yes.
treatment options are multiple available right now, from
Mm.
topical creams like triple combination, tranexamic acid, oral and topical, depigmentary agents like kojic acid, glycolic acid. These are all topical preparations available for melasma. At the same time, we have very good chemical peels that are available. So chemical peels are something that remove the superficial upper layer of your skin. It is
Mhm.
nothing like somebody is going to remove your skin out. It is just a simple application which gives you a very good, nice skin rejuvenation
Mhm.
with reduction of pigmentation quite a lot. So chemical peels, the advanced chemical peels you can go for. There are multiple types of peels available in the market, and the quality of the peel matters a lot. Then we can go for laser. So laser is something which targets the melanin pigment and helps destroy the melanin from the pigment. So laser is one of the key important factors. At the same time, micro needling plays an important role. So micro needling like Dermapen and all also play a very important factor in reduction
Mhm.
of melasma. Microdermabrasion can be done, and PRP therapy with Dermapen. So PRP is platelet-rich plasma for face. With Dermapen is one of the most advanced, nice treatments available for melasma. So,
Mhm.
and I would still say that no single modality helps with melasma. A combination approach will give you the best results.
Right. And as you mentioned these procedures, laser treatments, etc., doctor, one of my question is that we know that qualified dermatologists like you do these or have give these services at their clinic, etc. Then we have quacks, then we have parlors, and of course the rate varies, because finance is also one of the components in choosing the right thing. But what's your say on these parlors? Because they also have peel and laser treatments. Many a times they offer. There are quacks as well, and uh, their numbers is rapidly increasing. So, what's your stand on that?
So Samyukta very rightly pointed out that as we said, these are procedures. Okay, they need to be decided according to the skin type and the time and the quality of peels. So when we as a dermatologist also get a lot of representatives who come with their peel options, there are few peels which are good, and there are few which are not that nice. Like we see a lot of reactions with that peel as well, which leads to more hyperpigmentation than curing it, because if it goes too deep inside and it is causing a burning or a superficial burn, you are ending up with something worse than what you've started with.
Hmm. Right.
And it is, you cannot compare a knowledge of a board certified dermatologist with a parlor person, because they don't have the knowledge, and you cannot
Hmm.
expect them to know on exactly what power to use for which one, to differentiate between epidermal pigmentation and dermal pigmentation. I'm sure most of them won't even know what is epidermal and dermal.
True.
So expecting them to know so much is impossible. And then how do you trust them by treating for your treatment or for your face, and that is your face that you're giving to somebody. Parlors are very good for facials, and you should continue that like a normal cleanup or something, that is still okay. But chemical peel is something which is beyond their expertise, which they should not be getting into when they don't know the adverse effects, the contraindication, or how to handle those. Usually what we always see is people do end up doing this now in parlors as well, and then coming to us with side effects or burns and hyperpigmentation and all of that. So that is very difficult to treat then. So I would just say, you are very precious. Don't sell yourself too short, and give your face to anybody and everybody. Just choose who's your care provider very wisely.
True. And don't become a classic case of penny wise pound foolish. So don't do that. Ultimately, as doctors very well has said that what happens जब हम पार्लर से या कहीं और से इस तरह के प्रोसीजर्स या ट्रीटमेंट्स कराते हैं तो अल्टीमेटली हमको एक डॉक्टर के पास जाना ही
जाना ही
पड़ता है.
पड़ेगा.
तो इसलिए don't make it all over so lengthy, so complicated. सबसे
मतलब
पहले
हम
डॉक्टर के
सर्वे
पास
करेंगे,
जाइए.
हम सर्वे करेंगे तो वही वो 10 में से 9 लोग वापस डॉक्टर के पास जाएंगे ही जाएंगे, बिकॉज एक बार शायद अच्छा हो जाएगा उनका, फिर दूसरे टाइम उनको नहीं पता होगा, and they'll be stunned because a little bit of redness or this thing also they'll not be able to handle it very well.
राइट. प्लीज प्रोसीजर्स में, ट्रीटमेंट में अपनी स्किन को लेकर, अपनी हेल्थ को लेकर रिस्क मत लीजिए. ट्रायल एंड एरर, हिट एंड एरर्स मत कीजिए. गो टू द राइट पर्सन विच इज अ क्वालिफाइड dermatologist. I'll quickly go through some of the questions that have been asked by our viewers.
Sure,
So
sure.
Ria Sathi is here. Ria's question is, should I avoid specific skincare products or ingredients if I have melasma?
Hi Ria, thank you for this question. So exactly, skincare products make a very major role in melasma. Cosmetic procedures or cosmetic products that you use are one of the key important factors which can lead to melasma. So using them wisely, since so anything which is good for your skin, like skincare sensitive products, like I would just sorry, I'm just naming a brand like Clinic and all, are good for people who have sensitive skin and being treated with melasma. So choosing your skincare products right without any added ingredients like bleach or hydroquinone and steroids and all is very important.
Right. Firoz Khan is here. His question is, what can I do to protect my skin from UV radiations which can trigger or worsen melasma?
I think Sayukta, we've already took this question that protection of skin with sunscreen and physical protection with wide beam hats, covered clothes, using a scarf, using big sunglasses. These are few of the factors where you can protect your skin with a sunscreen as well as physical methods. Sunscreens also have two types, chemical and physical. So where you are going for, if you're going for a sun holiday or something, prefer a physical block because that is more protecting as well as, but they do leave a white cast. So on your regular day usage, you can use a good chemical sunscreen. So yes, UV radiation, protecting yourself from a UV radiation can help a long way from melasma, as well as after your treatment to prevent recurrence and all. Also, sun protection is a key important factor.
Right. A very common question that most of the patients of melasma will ask is, can melasma be permanently cured? What's your answer to that?
Melasma can be permanently cured is I would say no, because the melasma which is existing can be cured, but if you don't take care of it further and if you're again exposing yourself to sun rays, there are hormonal imbalances happening in your body, you're not taking care of your lifestyle, then recurrence is very common in melasma. Hence maintenance is a key factor in melasma.
Can melasma turns into cancer, doctor?
No, melasma is a very benign condition. It does not turn into cancer. It's a cosmetic concern itself. So it leads to pigmentation, but it's a benign hyperpigmentation, so it will not lead to cancer. So you don't have to worry about that. But make sure that whatever you have on your skin is melasma. If it is something else, which is like a melanin deposit because of melanoma or anything, so that is something which can lead to cancer. So have a definitive diagnosis by a board certified dermatologist that that is melasma.
That makes it even more important to go and consult a qualified dermatologist in case you have any problem
Yeah.
regarding your skin. And before we wind up the session, doctor, any take home message or anything that you would like to add?
We had a very good interesting session, Sayukta. I think we've covered most of it. I would just again emphasize on the fact of sunscreen usage, choosing the correct method. Don't use over the counter medication for melasma. Don't use medications for a long time without consulting your dermatologist. Do good procedures from a certified person, and there are very nice treatment options available for melasma. So if you're bothered by melasma, you don't have to live with it anymore. Come meet a dermatologist and get yourself cured.
Right. Thank you so very much, Dr. Krupa. It was wonderful talking to you. Thank you for your valuable time and this very informative session for our viewers. Thank you so very much.
Thank you so much, Samantha. Thank you.
It was great hearing you, doctor, and we really look forward for many more such sessions with you in coming times.
Sure, sure. Love to. Thank you.
And thank you, doctor, and viewers. Thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Stay happy, stay healthy. Take care of yourself. Goodbye. Have a good day ahead.